Awesome. So again, welcome. I am going to put in the chat a link. We did a survey last year to kind of check the pulse of the group and see where we were. We're doing a survey again this year. So I'm going to post that in the chat when you all get a minute. It's only about 5 questions, and it's things like, how are the meetings? Are they too often, not often enough, just right? Those types of things. So just take a moment to fill that out if you would. And this morning we have Amy Mosley with us, who's going to talk about Unite Us. And Amy, I'm going to go ahead and give you host privileges so you can share your screen.
Okay.
And then we will catch up with everybody after Amy talks with us. So.
Okay, let's see here. There we go.
Wow.
Okay, so we'll just start. So let's see if we can, let's do it like this. Okay, so we'll start with, I'm sorry.
Let me just ask everybody to put yourselves on mute, please. We're getting some feedback there. Thank you.
So I'll just tell you a little bit about myself. I know some of you already. I'm Amy Mosley, and I work at Healing Hands Health Center. And I actually started at Healing Hands Health Center in 2015. And I was Helen's assistant, and still in many ways her assistant. Love Helen. I think she's on here. So I started there in 2015, right before we were moving into our new building. So it was really busy. And moved into a couple other roles while I was there. Was the practice manager before I moved to Atlanta. I think some of you know I live in Atlanta now for my husband's job. But a lot of the things that I have worked on for Healing Hands is to try to make us more efficient by using technology. A lot of the projects I have worked on have had to do with that. We used to be paper charts, and now we're, electronic health records, different things like that. So I love technology, and I love using it to make life easier. So a lot of experience with that. When I moved to Atlanta, just worked as needed and did projects for Healing Hands. But then when this opportunity came along for us to have the Unite Us platform, I've come back on board to be the community resource specialist and to help us, integrate Unite Us and use it effectively with our team. And we really, really like it. Now we don't know what we did before it. Let me go to my next slide. Okay. Oh, it's hard. I can't see this. So I don't know what you guys do if you're talking with a client, or in our case, a patient, and you find out they have something, going on that's outside of the scope of your service. I guess we all have different systems that we have in place. What we have always done at Healing Hands is give them a piece of paper and say, okay, well, here's some resources. And the patient was really left to navigate it on their own. We've never been able to afford a caseworker or social worker. We'd love to have one, but we've never been able to afford that. So we really put it back on the patient that they would have to, take this piece of paper, call around, and get the help they needed. And I know that the United Way of Bristol, a couple years back before COVID, they did a really good poverty simulator. And one of our staff members went to that, and she's always telling us about it. Like, what we might think is easy, to call up a place and say, hey, I don't have enough food, that may seem very insurmountable for them. So that what we love in Unite Us is now we find out, okay, the patient doesn't have enough food to make it through the end of the month. They don't know how to apply for SNAP benefits or how to get emergency food. We can go into Unite Us, do a referral, and then that agency calls them and gets it worked out. They don't have to call the agency. They don't have to go and fill out a bunch of more paperwork. It is really, really nice. The one thing they have to do is when they go in, you have to get their permission to refer them to another agency, but Unite Us makes it very easy. You can send them a text message through the system, and that's almost what everybody picks. Even older people that I didn't think would pick text messaging, pick text messaging. And they do their waiver, and then it gets sent on, and that patient gets the help they need right away. Questions about that so far? Am I talking too fast? Okay. So once, when you give them a piece of paper, you don't know really whether or not they ever got that care. And if you're like us and most nonprofits, you never have enough staff. So you don't really have someone that's going and following up and saying, okay, were you able to get food? Were you able to get transportation to your appointment? All these different things. So now in Unite Us, you continually get notes back from them saying, okay, this person, we received the referral, we called them, they didn't answer, or we called them and they did answer, and they're coming in. You continually get updates on the patient until it's closed out. Either they were helped or they denied, they decided they didn't want the help. Does that make sense? It's also just been a really big game changer for us, because before we asked certain questions, but we didn't ask all the right questions, because we didn't really know what we were going to do if we asked, do you have enough food? And they said no. Does that make sense? Or if we asked, are you able to pay your rent? And they said no. Well, what were we going to do with that information? So now that we have Unite Us and we can refer them out, we have a screening tool that we use right now as part of our application process. But also you can work with Unite Us to create your own screening tool within the system, which is what we're hoping to move to as well, so we can get away from paper. Questions about that? Unfortunately, I would love to show you how easy it is to use Unite Us, but we can't because we've got patient information in there, and it's like protected software for them. But if you want to see how easy it is to use, one of the community engagement managers can do a demo for you. Let me go to the next slide. So the perks to us is we think it's extremely user-friendly, and it only takes about an hour to learn. I was kind of nervous when we kicked off on June 8th. That's when we kicked off our site using Unite Us, and that's when a lot of agencies in the area kicked off. I thought, well, gosh, I feel like we don't know anything yet. How do we know what to do? Well, they send you the training, and it really only takes about an hour to get trained on how to use it. It's not a huge time commitment. They will continue to do training that you don't have to go to, but you can. I usually do every month. It might be every 2 weeks. It's often. They do like a lunch and learn, and you can sit in and get different tips on how to do different things. So it's very user friendly. It's extremely easy to get in there and learn how to use it. Also, you'll have a community engagement manager that will work with you. And actually, if you're like us and you're in Tennessee and Virginia, you'll have two. You'll have the one for Tennessee and you'll have the one for Virginia. And I think they're on here. I know Laura, I saw Laura. Is Mallory on here? Yeah.
Yes,
so
I'm on here, and I'm dressed as a zombie. I promised
Oh,
I would
I
make an
love
appearance
it.
with this. So that's
Are
why
you
my
just-
camera's been off. We just had a Halloween information session for Tennessee, and it lasted right up until this meeting. So
Oh my gosh, I love it.
I was so excited to see that, Mallory.
I saw you and I was like, okay, is that like a filter or is that really her?
Great.
Yeah,
Awesome.
this is face paint that I'm very excited to wash off. But there we go. I promised I'd show it. I did my part.
You like it.
So they are both on here. If you all have anything to add after this.
Yes, and they're awesome to work with, and they can do a whole demo for you and show you what it takes to, to get started. I think a lot of people worry when it's technology, will we have the staff to do this? Will we have the resources to do this? I mean, if you have a computer and Wi-Fi then you have the resources to do it, if that makes sense. You will need a staff member to man it, but it's not going to be it's not going to take up their whole day. They don't have to sit and be on Unite Us the entire day working on this. It's a tool that you use. You're replacing your other tools that you used to use, basically. Do most of you guys have people that work with patients to do, or clients to do referrals to other agencies? Most everybody on here does that. Yeah, I see. I know Lori does. Lori does a lot of that. But yeah, so it's really nice tool to use. When you send a referral, you'll receive updates about that person, so you'll know what happened to them all the way to the end. And if when you take in a referral, the other person will see what you did for that client, which is really nice. The other thing that's very helpful, this is a very broad program. I mean, it's serving, I think, most of Tennessee now. Mallory, is all of Tennessee involved?
So we will be in the rest of Tennessee by the end of November.
Okay, I knew it was close, and I'm pretty sure all of Virginia, most of Tennessee. So this is very broad and reaches many people. So yes, here in Bristol, most of us know each other and know what we do. But like at Healing Hands, we see people all the way, up in Grundy and Scott County, and we see people all the way in Sevierville in Tennessee, because it's really hard for people to find dental care right now. So this helps other agencies that don't know us to know us, because they go in there and they type in, I'm looking for dental for my patient, and it pulls us in, which is really nice. So you'll also receive referrals that maybe those people wouldn't have known about you if you weren't on Unite Us, because it's hard. We're all really busy. It's hard to cover all of Northeast Tennessee and Southwest Virginia in outreach to let people know you're here and what you do. So it's a really nice tool for that. We love it. The technical support for it is really, really good. It's the best of any platform I've used, especially compared to electronic health records. It's super nice. You just go on there and you type in a chat, and they get back to you almost immediately. And they will keep working with you until the problem is solved. And my absolute favorite thing about the system is, I don't know what their technical name is. I could probably look it up, but they have what I call the angels behind the scenes. And they
network hub support.
Yes, that's what they are. They're angels. And they will send you an email and say, you accepted a referral a week ago, but there's no notes as to what happened to them. So if you forgot to go back in there and put, okay, we're seeing this patient on October 29th, or if you, which this happens, we work in nonprofit world where we're really busy, you forgot to get back to them, it reminds you, so people don't fall through the cracks. And I know, if we're all being honest, we've had people fall through the cracks at our agency. And so these are the people that come in and check up on you and make sure that nobody's fallen through the cracks, which I personally really like. I think it's that's my favorite perk to the system. Questions? I feel like I'm talking really fast. So I know a lot of people are probably wondering, how do I get going? So when you first get started, you have to fill out some paperwork so that they can build your personal site within the site that shows, everything about you, what kind of referrals you receive, what kind of services you offer. And so there is some work in the beginning, but I would say, I don't think it takes more than 2 hours to fill out that form. It's not, it's information that you've probably filled out 100 times for different grants and things like that. It's not a hard form to fill out. So that's kind of how you get started. And then once they have your site built out, you do your training, and then you're good to go. You're ready. Questions about that? I'm gonna look over here at my notes and see if I'm forgetting anything. So I will say the other thing, and you know, especially at Healing Hands and medical, you know, all of our patients in medical work, so they're not extremely low income, they're low income, but not the extreme low income. So we didn't always see that they had as many social needs outside of healthcare as maybe some of our dental patients did. But I will say since COVID, that has changed. And I think a lot has to do with the inflation. You know, food is really expensive right now. And so we are seeing way more people need access to food and things like that than we ever have had. And Unite Us this is a great time to switch to it, because I'm sure if we're seeing that, the other agencies are too, that the demand for needs is higher than ever. And so Unite Us could really help you to be able to get them the care they need quicker. You know, it's almost immediate, especially for the food. They've been really, really good. The agencies that provide that have been really, really good to get people things right away. So I think post-COVID, this is the time to do it. You know, this is when the need is high, very high right now. Oh, here, there's the link. Thanks, Laura. I'm looking to see. I'm seeing if anyone had a question. Okay. Any questions about how we got started, or if there were bumps in the road or anything like that?
Amy, the only thing that I will add is, you know, we are so thankful at United Way that Healing Hands has taken Unite Us and implemented it in within the agency. We brought this to the attention of our partner agencies back before it launched in June. It was in the first quarter. And so the other thing that I really like about Unite Us is that if we all use it,
It's way better.
we all know what's going on with particular clients, and we can be more efficient and duplicate less duplication of services. So, you know, by the Envision Center using it and Salvation Army and others, you know, that just makes us even more efficient with our work. So I am pleased that it has been positive for Healing Hands, and we encourage everyone to participate in Unite Us.
Yes, I'm going to chime in. I agree. The more people that are on there, probably one of the only things that annoys me is when I'm in there and I know there's an agency that provides this care, but I'm like, well, shoot, they're not in here, you know? And it's just way more efficient if we're all in there. And I know it's a commitment, like a time commitment from everybody, and everybody's trying to figure out, you know, who are they going to get to make this happen at their agency. But I do think while it might be a little work on the front end, it's going to save you time in the long run. It's going to.
And can I just, for everybody that's in here, can I just see kind of a show of hands? How many of you are already using Unite Us?
Yeah, me.
Casey, okay.
How many is it? Did you see?
I didn't. I saw two. There's two. Yep. So it's kind of a mixed group, and I think that Unite Us can be really useful. You know, a lot of people might think of it as, oh, well, that's a social service type of thing, but it's really kind of bigger than that. It's a community organizing platform. So, yeah. So if you haven't, again, Laura has posted, and we'll share the chat comments, you know, so that you have that link to join the Unite Us network if you haven't already.
Does anyone have like a particular reason that you have not done it yet? Like, is there a roadblock you want to talk through that's keeping you from wanting to do it? I know one of these meetings I was on, they were saying, well, at like our soup kitchens and stuff, we don't have Wi-Fi or even a computer, you know, so I don't know if anyone else is having those kind of issues as to why it doesn't work for them.
The only reason I've heard, Amy, was that they currently have another system, like say HMIS or something like that, that's
Okay.
required for them to use. And so they have to still do that software. And
Yeah.
so to do Unite Us would be another step. The only thing is Unite Us is so much easier than HMIS. No offense, HMIS, but uh, you know, it really doesn't take that much time to upload this information as well, and then we could all be using it.
And it's really quick. Like Lori said, you're not putting in a ton of information about the patient because they don't want too much, you know, with HIPAA compliance and everything. You know, you're not having to put every detail about this patient in there. I mean,
And I'll add to that also. I've had some other people have signed on who were hesitant because they did have other systems that they had to use. But I think sometimes there's a misconception. You don't have to be in Unite Us, put every single person you serve in Unite Us. Those who did have that conflict, they're now saying like, oh, okay, it's when I just need to refer outside of this outside of their own organization. And then too, I've had some people who started out that way, but then they saw the data piece that they were able to get from using the platform, and they thought, never mind, I want to put everything in here to get us the most informed data. And that, just to piggyback off of you all saying, you know, how important it is to have everyone use it. You know, I'm a lifelong resident of this area. I'm Appalachian through and through, if you can't tell. And I really understand the struggles that we have, and just the more people we have using it, the more we can show what our needs are and the more resources we're going to get. The data that we're going to get from this is just going to be instrumental in getting us more grants, getting more government funding, and just to inform us on our own budgeting. You know, like if we see, hey, we've had a lot more referrals for transportation than we have, you know, food, for instance, maybe we need to shift things around. So I just want to add that piece on there as well, because I have a meeting at 11:30, so I might have to hop off here in a minute.
And
But
I
you
wanted
all
to
are doing
say,
it.
I would like to add that Family Promise we're required to use HMIS for our program, but we also use Unite Us. And it is a wonderful tool that we love to have. And I too encourage everybody to get on it because it doesn't take all that much extra time. And it gives you so much more of a good view of being able to refer your clients to other places.
Thank you for that. I love hearing that.
Mallory, I'm kind of putting you on the spot. I know you have to go, but one thing I had wanted to show, but I know we're not supposed to show inside the system, was some of the data that you can see, because I love that part, and I should have put that on this slideshow. Is they have awesome reports that they can generate about our area and about what the different needs are that they're seeing, which is super nice. Are you able to show anything like that, or is that too last minute?
Laura, do you have time to pull up a demo? I don't really have one ready.
Let me get signed in.
Sorry,
Oh,
Laura.
no problem at all.
Oh,
Yeah.
wait, and she's gonna have to share her screen. Let me see if I can help. If not, maybe she can email that out. It's just really nice.
Well, and that's what I was going to say. I mean, I think, you know, and Amy, if you're done with your presentation, it might
Yes.
be to unshare
Yes.
just so we can see everybody's faces.
There we go.
Thank you. But, you know, I would encourage everybody to reach out to Mallory or to Laura if you haven't already signed up, and talk with them. And if you all want to send kind of a screenshot or a couple of screenshots, we can send that out when we send the recording of this out, so that everybody can look at what the benefits are, the data point benefits, which are important, as we all know, for grant writing and for, you know, just bringing more resources into our area, just like y'all said.
Yeah, that's no problem at all. And yeah, I just want to say too, if there are things that's making you just a little hesitant, Unite Us we're really able to customize the experience to what works best for you and your organization. So any questions or concerns you have, just meet with Laura and I one-on-one, and we would love to talk through those with you and just kind of figure out a way to where you can participate with this, but that it works best for you. So those one-on-one meetings is really when we can get down into what your day-to-day looks like, and then we can say, okay, let's look at utilizing it this way or that way. So definitely reach out to us and schedule those one-on-ones.
And Laura and Mallory's emails are both in the chat box. So feel free to reach out to them. Do we have any more questions for Amy or for Mallory and Laura?
I have it pulled up if you want me to share just really quickly.
Great. Let me.
Well, and it too is this program, it is being offered free of charge through the Department of Human Services in both Tennessee and Virginia. So any of us that are on these bordering states, you can access this software at no charge through the Department of Human Services. So don't let cost be a hindrance.
Absolutely.
Very important point.
Yeah.
Thank you for mentioning that. Yeah, Unite Us as a whole, we, our nonprofits and community organizations and stuff, we don't want to take money from you all. We're truly here to make your all's lives easier and help strengthen the community and all of that. So to do that definitely includes not taking the limited funds, because we know how it is in this industry. So don't let that be a concern either.
Yeah. So that's just a quick snapshot. I'm sorry. You go ahead. Oh, no. So this is just a really quick snapshot of some of the data that you can collect. Again, it's about telling your story and your community story. So here you're able to kind of see a breakdown of the demographics for and of course, this is a fictitious environment right here. So you're able to see that, the demographic information. We can do stacking. So you can see, in this specific network, that people from the ages of 26 to 44 are actually the highest. That's where a lot of the referrals are coming from right there. And I do want to click on this because this is always my favorite, right here by service type. So in this specific network, you're able to see that, 32% of all the referrals being made is for employment, and food assistance is 23%. But we can actually drill down further, and you're able to break that down. So for that employment, actually 71% of the employment referrals being made are for career skills development, while 24% is for job search placement and 5% is for job training. Now, along with the network data, you also get your own organizational data. You do own your own data. We do not. So for instance, say you're part of the network and you decide to leave, you take your data with you. We do not own it. And it's going to include every bit of information because we want to give you everything, and it can be downloaded into a CSV or Excel file, and you can whittle it down to whatever specific information you need. But again, you own it all.
Awesome. So does anybody have any questions for Amy or Laura? I think Mallory already had to head out. Well, ladies, thank you so much. And thank you, Laura, for pulling the data points up there at the last minute.
No problem. Thank you.
Because I think it is important that, it's measuring this so that we can share this on a regional level, on a state level, so that Nashville and Richmond understand what's going on in Northeast and Southwest.
I love that you said that, because I say that when I present to any of my rural communities, that this is your opportunity to raise your hand, tell your story, and you cannot disagree with the data. There's no fighting it. So when they see what you're doing, they're not going to be able to turn you down for additional resources.
Yep, exactly.
Thank you for having us.
Thank you. And Amy, thank you so much for
Thank you.
And Lori and Dottie and everybody who's using it, for sharing how this has been useful and helpful to you all too. And I think it is as good as we make it by participating. So, all right. Thank you.
Thanks.
Okay, so let's get into some updates. I know that there's a lot going on. We've had some people who couldn't make it, but Lori, I'm going to start with you. I'm going to call you Lisa and start with you. You're on mute right now, but what's going on with United Way?
Okay, there's a lot going on with United Way, as always. We continue to field many calls again for every type of resource you can possibly imagine. Whether I won't go into it. Anyway, we do have the COVID CARES dollars still available through both cities for anyone that lives in the city limits of Bristol, Tennessee or Bristol, Virginia, and they have been financially impacted by COVID. Send them our way. We can help them with food and utilities. As you all know, we are in the very middle of our campaign. And so the community looks to us to have the resources to meet the community's needs. So we really encourage everyone to support the campaign at whatever level, whatever you feel is appropriate for you and your family, but we need the support of everyone in our community so that we can meet those needs in the community. We can do small one-on-one meetings. We can do Zoom meetings. We can mail you, email you or snail mail you pledge form information, whatever we need to do to gain your support, we will do so. You just need to reach out to us. We do have an opportunity for some additional PPE with the Bristol, Virginia Fire Department. So if you have a need for any PPE, just reach out to me and I can send you the contact information for that. We do still have, we have gotten additional funding for our Reunite program, which is the program to reunite homeless individuals with their family located in other communities. It is not for people to take a vacation. It is not, for them to go round trip. It is one-way tickets to get them back to their family. And we do verify that the family is in the city they're going to and that they have wraparound services there. So we do have additional funds in that program. And then American Merchant, the towel manufacturer here in Bristol, is doing another towel sale of their seconds. And they're doing that for United Way of Bristol on November 19th and 20th. And as soon as we narrow down those details, we can get that out. That's a great opportunity to get some very nice quality, hand towels, washcloths, and bath towels at very reasonable prices for Christmas, which always makes a great gift. So anyway, other than that, we're just working really hard getting, letters out and things like that. But we encourage everyone's support and we appreciate everything you all do to make Bristol a better place to live.
Great, Lori. Thank you so much. Appreciate it.
You're welcome.
All right, so cities. Christina Blevins, are you still on here? I didn't see Ellen.
Hey guys, I don't want to go after Lori. She always does a great job. So, I don't really have very much to update you guys on. Lori already talked about the CARES funding that we have available through the cities. It is actually just now in the last couple of weeks starting to really take off, which in the beginning we were nervous because we're like, here we've put all this money into these programs and people aren't using it, but it's getting used now, isn't it, Lori? So that's good. But again, as she said, the key is people financially affected by COVID. So if you have people that are already on government help and have had COVID, that does not make them eligible for additional help. They have to financially show us that they were laid off work or they haven't worked in a couple weeks or something like that. Our community development block grant program for the housing rehab has been very busy, and we do have a bit of a wait list But if anybody has people that do need emergency repairs and they think they might qualify under our program, I'm happy to talk to them. So send them my way. And that's all I have if anybody doesn't have any questions.
All right, thank you, Christina. Anybody have any questions? Is there anybody else from Bristol, Tennessee City that has any information?
Margaret's here.
You see that?
Are we to the schools part yet?
Nope, we're gonna get there in just a minute.
Okay.
Anybody from Bristol, Virginia? Thank you, Christina, appreciate that. Anybody from Bristol, Virginia City? I don't see anybody on here. All right, let's move on to housing. So Bristol, Virginia Housing Authority, I see a couple of people here. TJ, Victoria, looking through here. Do you all have any updates on Bristol, Virginia housing?
I am at the Envision Center still, so we're still taking referrals over here. I can put the Envision Center number in the chat for you all. I have been helping as well with rent relief assistance we have the money through Bristol, Virginia City for rent and mortgage relief if you've been affected directly by COVID. And then we've also been using the state money through Virginia Housing. And they have been awarding the 3 months in advance. So we do have those programs as well. So, I mean, if Lynn was here, she'd probably have more of an update, but that's all I got right now.
Fantastic job, Victoria. Thank you. Any questions? All right, what about Bristol, Tennessee housing? I don't see anybody from the Housing Authority. Dottie, Family Promise is working on housing in Bristol, Tennessee. Do you have any updates?
Yes, we're still doing homeless prevention, and you can find us in Unite Us. We have rent and some to keep people in their homes for who are being evicted. So our number, Margaret, do you have the number? Could you put it in the chat so that we also, it's Sullivan County, Tennessee. Sullivan County, Tennessee.
Well, and Margaret's traveling, so.
Yeah, I'll put the number in the chat.
Because I don't have it right here.
Okay. And it is
I never call us.
Bristol, Tennessee and Sullivan County, Tennessee, right?
Yes, Bristol's in Sullivan County.
Okay.
Because we're in Tennessee. We're not a separate thing. In Virginia, they're separate, but not here.
So any questions or comments for housing on the Tennessee side or for Family Promise? All right. Thank you, Dottie. Appreciate it. And Envision Center number is in the chat. Family Promise of Bristol number is in the chat. So feel free to reach out to either of them if you have anybody who needs help with housing. And if you're not sure which one to call, just pick a number, and if it's the wrong one, they can refer. They're great about working together across that state line to make sure our folks are taken care of. So, all right, let's move into health and healthcare. I know we heard from Amy with Healing Hands. Is there anybody else? Any updates on Healing Hands? Brittany, do you have some updates from the strong ACC? I'm going to put you in healthcare. As we know, ACEs and resilience are all about healthcare.
Yes. Sorry about that. I was trying to get unmuted. And for those of you that don't know me, my name is Brittany Bowles, and I'm the new community engagement specialist for the Strong ACC. So I'm 4 weeks in now, so still gaining my footing on everything. But as far as updates, for those of you who are members, we are about to send out an e-blast, is what we call it, an email of all of our news and notes, and included in that is going to be our next all-member meeting which we have set the date for. It's November the 15th from 12 to 1:30, and it is going to be via WebEx. So we're super excited about that meeting because we'll get updates from all of the working group chairs. So we'll be able to see where we're at with the 4 working groups. You'll also be able to get some Unite Us updates. So thank you to Amy for presenting today, because that was so good and encouraging to see, all the different providers that are utilizing this amazing service that we have. So I think that's all I have for Strong right now, but mainly is we hope that you all can attend that all-member meeting on the 15th.
Great. Thank you, Brittany.
You're welcome.
Any questions for Brittany? Okay. Mariah Evans with Mount Rogers Health District could not be here, but she did give some updates. The cases continue to decline, although 4 localities in Southwest saw an increase in pediatric cases. Positivity rate for COVID cases is 14.1%. The highest vaccination rates are in Bristol, Galax, Smith, and Washington. And the biggest growth last week was 16 to 17-year-olds and 25 to 34-year-olds for first dose, and then 35 to 44-year-olds for fully vaccinated. The FDA has authorized boosters, and last night the CDC adopted those recommendations, which means that boosters are now approved and people can get them of any of the 3 available vaccines. So people who got Moderna and Pfizer fall into one of the recommended categories 6 months after that second dose. And J&J is eligible for a booster 2 months after that initial dose. And then also, don't forget to get your flu shot. So that was from Mariah at Mount Rogers. Brittany, there's a request for you to talk a little bit about how to become an ACC, a strong ACC member.
Sure. So usually what we do for that is we will set up a meeting with Mark Cruz and I, which Mark Cruz is the director of the Strong ACC. So we'll set up a meeting where we can learn a little bit about your organization, and we can tell you a little bit about the Strong ACC and what we have to offer, and how we can help your organization collaborate with others. And so, and really it's just as simple as filling out a membership agreement. There's no fees, there's no annual membership fee or anything like that. But we'll just set up that meeting, and I can put my email address in the chat. And so whoever's interested, just shoot me an email and we'll get that meeting set up, and then we'll get that membership agreement filled out. But it's pretty simple to join, and yeah, we would love anybody that's interested to reach out.
Great, thank you. And if you all do have any questions that come up later on, feel free to post them in chat if you don't have questions right away. All right, anybody else healthcare? I was looking through the list. I'm not as good at this as Margaret is, of identifying everybody. Jo Beth, you're with Aetna, right? Am I right in that?
Yeah, I'm a community health worker with Aetna Better Health of Virginia, and I help connect people to housing, food, any kind of community resource that they need all over Southwest Virginia. I cover people all the way up to Galax, from Blaine County, Grundy, and all of our region, or the Mount Rogers district, I guess. So yeah, it's been great to hear the resources that are in the area.
Great.
So thank you.
Wonderful. Anybody else from Ballad, from healthcare?
Jo Beth, would you mind to put your contact information in the chat for me, please? I've been struggling to find some resources up in Southwest Virginia, and me and you may become best friends.
Yeah.
Thanks.
Great. Wonderful. All right. So what about, let's move on to schools. So I know, Kay, you're here. Did you have some updates from Bristol, Tennessee City Schools? Anything you want to share going on there?
Yes, I do. Melissa, can you hear me? I'm having a little video trouble today, quite obviously. We do have a calendar change coming up. I think information will be going out really soon about that with November 1st and November 2nd. There is a change that November 1st, schools will be closed on our side of the state line. And on November 2nd, we have declared that a flexible learning day for students, and it will be an in-service day for teachers. Information is going to be provided soon, if it already has not, for students to pre-register for that flexible learning day on November 2nd. When our calendar was first planned, November 2nd was thought to be a scheduled election day in Bristol, Tennessee, but there are going to be no local elections held in our schools on that day. On the COVID front, I would say that we are continuing to test, do free testing for students and staff members. Each school's clinic is available for testing during school hours. Please know that students will not be tested without parental consent. Even if a consent form has been signed, parents would be notified before students are tested. And along that same line, we are continuing to test by appointment after school at the administration building. Student flu vaccines were administered this week by Sullivan County Regional Health Department, and our employee vaccines will be next week, Monday, October 25th, Thursday, October 28th, and Friday, October 29th. These vaccines are for BTCS employees, retired employees, board members, and employees' family members. So family members are eligible as well. If you need more detailed information about times or more details about COVID testing times, you can always visit the website at btcs.org. Thank you, Melissa.
Thank you, Kay. Any questions about that for Kay? Awesome. All right, thank you. Anything else from Bristol, Tennessee City Schools? Anybody else? Okay, so Bristol, Virginia Public Schools also has a schedule change, just as an update. I didn't see anybody from Bristol, Virginia Public Schools on here. Students will not have school on October the 29th, and they will not have school on November the 1st. And they'll follow the election day schedule for November 2nd because there are elections in Bristol, Virginia. But this is as a response. They're offering the Moderna booster to their employees on October 29th. They're already struggling to cover shifts and buses and that kind of thing. And so if there are immune system reactions to the vaccine booster, they want to be prepared for that. So they've gone ahead and canceled school, but childcare is provided for working parents in elementary and middle school. And I will post a website from them that has all of that updated information. So if you have any kiddos who are in Bristol, Virginia Public Schools, you can reach out to them to make arrangements. All right, anybody else on schools? Anybody else here from other schools? All right, let's move on to food and food security, food insecurities. Anybody here from Second Harvest? Any updates?
Melissa, I did talk to Jim White this week with the Bristol Emergency Food Pantry. He said things were picking up just a little bit with the food pantry, but still not seeing the demand that we were seeing prior to the increase in food stamps and things.
Okay. Thank you, Laura.
I'm from Second Harvest Food Bank of Northeast Tennessee in Kingsport. So I joined in because it was on the Unitas. So I thought I may as well stay and listen to what's happening in Bristol. I was with Ann Mosley. I started to use the Unitas when it was first launched. I was just thrown into it. In fact, I just joined the bank in May, my first job here. So I was thrown to learn the program, but it is very, very helpful and useful. And I find that it helps a lot of other people besides their food needs. We have helped ones to pay the electricity bill. We have helped ones to need clothing, and even what do you call that, some housing needs, homeless people. So it is a very, very useful tool. In the beginning, like everyone said, it's very hard. I know we're scared to use it. After we got to use it, I really enjoy it. Like I say, you don't really have to sit in front of the computer. You get notification through email, oh, that's a case for you, accept it, and then you just work on it. Less than 15 minutes, you get it done. As far as the food needs are concerned, I think our bank here is having the Project Thanksgiving next month, and it will be on the WCQR radio station. And I think it'll be running for a couple of weeks. And then we will set up a virtual food drive. Those who call in, I guess, we'll send them to the various pantries where they can collect a box of food meant for this occasion.
Wonderful. Thank you, Lai. Appreciate that.
You're welcome.
And good to know that you all are using Unite Us as well, and it's easy to use for you guys, because sometimes people have multiple challenges when they come to see us, right?
It is beginning, like I said, Mallory came by to give us a one-to-one session and explain. And we asked a lot of questions in the beginning. It's something new. When it's new, you're scared to use it and you make mistakes. It's okay, she's always there. We call her, or we have somebody we email to and they help us. So now it's easy. It is very easy, and I explained to my other workmate, she's learning too, while I'm busy with other things. She's in the receptionist. We have done it another way, that we have people calling in for food. We just address the food needs. So I say now we have to learn to ask them, is there any other way we can help you? So if you don't ask, people won't open up. So when we ask them, then they start to say, oh, I'm late on my bills, or, you know, I don't have clothing for my children, or I've been released, you know, from the jail. One guy, I mean, I'm not saying any name, I just got released and I don't have a place to go, and I won't start work till maybe another month. I need some monetary assistance. So we ask. So when we ask, people tend to open up. So after addressing their food needs, then we build a case on Unite Us, and then we refer them. So in that way, both of us, we feel happy that we have helped them. Not only the main needs when they call is for food, we have helped them with other needs that they may not open up if we didn't ask them. So that way I'm very supportive of it, because it's really a good system to use. You don't have to buy a software to download onto your system. It's just like you say, if you have Wi-Fi, you just go online and it's there.
Exactly. Awesome. Yeah, and so somebody wanted to say welcome, and can you share your contact information in the chat? So if you can post your email address in the chat box so that we can reach out to you, that'd be great. All right, anybody else? Thank you, Lori, for the update on Bristol Food Pantry. Appreciate that. Anything else food related? All right, what about childcare, after school care, parenting? Any updates? Anybody hear from any of our child care? Okay. Thank you, I appreciate that. And so our faith organizations, I know Chris Aaron had to run earlier and said that he did not have any updates. Is there anybody? Eric Myers, I see you're on here. Do you have any updates, information to share?
Well, just nothing earth shattering. It's just some things that we've got going on both in Johnson City and Kingsport. We did not do them this year in Bristol. We might do them next year. They were community serving days where multiple churches came together and served. So in Johnson City, we had about 160 volunteers from 7 different churches that served 27 different agencies, on one day, which was kind of neat. And we did something similar in Kingsport. We've been doing it longer in Johnson City than Kingsport, so Kingsport's was a little bit smaller. And we just, we haven't started it in Bristol yet. I need to first touch base with some of the local churches there to find out if they would be interested in doing something like that. So, but it was a neat thing to see. We always get similar kinds of responses from the agencies. They say things like, hey, it's really neat to see the body of Christ coming together and like serving together. It's one of the unique things about the event. And we're also helping, I appreciate you sharing the COVID numbers and the updates and everything, because we've been asked by Ballot Health, Summit Leadership was asked. And so we've been coordinating at a couple different medical facilities to just encourage the staff, because the staff, especially the ICU and COVID care, healthcare workers, are really taxed, and they're already working at a limited capacity, because I know that Holston Valley in Kingsport is down over 100 nurses than what they normally would have. So the ones that are working are, they're just working longer and working harder. And so we've got some initiatives both in Johnson City and in Kingsport at those hospitals to just rally the community. So this is beyond just churches, but it's just really, it's an open invitation to anybody in the community to come do some and participate in some really simple, basic things to just encourage these folks. So been doing a lot of time. That takes a lot of time to coordinate that kind of stuff. As anybody knows, when you coordinate things, it takes a lot. It takes a lot of time. But yeah, so we've been busy with those kinds of things.
Great, thank you, Eric. Appreciate it. And Margaret said that the mayor's Bristol, Tennessee City Mayor Malin Luttrell sent similar updates to Mount Rogers, and I think we do see kind of those similarities on both sides of the state line for our region. Sometimes Southwest Virginia is a little struggling a little more, and sometimes Northeast Tennessee is. So, and also welcome to Tom Quickle, who just moved back to our community. We're excited that you are back, retired from the faith community. So welcome to you, Tom. Anybody else from our faith community have any updates? All right. Let's just kind of open that up to anybody that we haven't hit yet. Does anybody have any updates, anything that they want to share, information on what they're seeing, what the needs are?
So I can go. Yeah. Hi, y'all. I'm Brandy. Yeah, I'm with Bristol's Promise. I'm the community resource navigator for the Bristol Connect program. And I don't know that I have any updates per se, but in working with partner businesses, as we all know, transportation is an issue in our Twin Cities, right? And so if anybody has any information or resources that they could share with me about transportation, my partner businesses typically start at 6 a.m., 7 a.m. And so we know our transit system really isn't up and going yet at that hour. So if anybody has any transportation resources that they could share with me, I would genuinely welcome them. Also, I'm still seeing the childcare issue, and I'm definitely still seeing the homeless issue. I actually sent a couple people over to the Envision Center this week. I'm getting lots of random one-off phone calls to our agency looking for resources, and I'm thankful for our partners that I'm able to refer to. So thank you all for doing amazing work. But I really feel like that this group is going to make a difference, and we're going to conduct change, and I'm grateful to be partnered with you guys. But if you all have any resources that you can share with me for those 3 key areas, that would be fantastic.
Thank you, Brandy. And we are meeting with Wes Ritchie from Bristol, Tennessee Transportation, and Melanie Fleener with Bristol, Virginia Transportation, in the hopes of coming up with maybe a 1-pager of transportation in our region, but just doing some research. So if you have any resources for transportation in Northeast Tennessee, Southwest Virginia, feel free to send them to Brandy. And Brandy, do you want to put your information in the chat for everyone? Thank you. All right, anybody else have updates, information?
I do, just a little bit.
Okay.
That's okay. I didn't know if I would fit into the health or, what kind of area?
Like, it depends on the information.
Sounds good. For those of you who don't know, my name is Casey Caudell, and I am also kind of new in my role. I'm the new Northeast Regional Coordinator for the Mental Health Association of East Tennessee. And so I am really mostly on the Tennessee side, but I do have two quick things that I would love to share with this group. The first is that we are the Mental Health Association of East Tennessee, or MHAET, as I like to say. We are going to be hosting our 2021 fall symposium, our fall psychiatric symposium, and it is coming up pretty soon, a lot sooner than I think that some of us realize, but November 18th till 19th. It is virtual this year, just like last year. And there is a bit of a fee, but we've got a lot of great speakers lined up. And so I always like to, plug that in here, because as we know, right, COVID has definitely affected our mental health. And that's kind of what brings me to the second update that I have to share, which is the Mental Health, Mental Health America, which we are an affiliate of. They just released on Tuesday their 2022 report, which I know it's weird to say like it's the 2022 State of Mental Health in America report, which is one of the most, I guess, like up-to-date reports that I've seen so far about how, right, COVID has affected our mental health. But it also, as it says in the name, right, it's reflective of the state of, I guess, mental health in America, and it breaks it down. Like, that report is broken down by state, so you can see, what the percentages are and the rankings are for Virginia, but you can also see that for Tennessee. And so I always like to plug that, and I can submit, I'll put in the chat the link to access that, because there are some pretty surprising statistics, others not as surprising. But like I said, it is data that is reflective of, 2020 to 2021. And they do on that website as well have, I guess, the old reports, so you can kind of look and compare and see how the numbers are definitely increasing with mental health conditions and just everything else going on. So that's what I wanted to do. I'll put that in the chat though.
That's great, Casey. Congratulations on your new position. Mental health is health. So let's just put all that together. But yeah, that would be great if you can share that report, the link to that report. And also, if you have a flyer for that symposium that you want to email me, I can put it in our community calendar.
Great. Yep, I can do that.
Yeah.
And Casey, this is Eric Myers again. What is your role again with the mental?
I am the new Northeast Regional Coordinator. So Emily Wells, she was the former Northeast Regional Coordinator, but I've taken over her role. So, yeah. And then I had another question, but I don't know who it came from.
It was me, Casey. Hi, it's Brandy. So I am seeing with my partner businesses more and more people that need mental health services, but the problem is they don't, one, have insurance, or they can't afford. So if you have resources that are on a sliding scale fee, or anything like that, or a place that I can go to get those that I can refer people to, I would greatly appreciate that information as well.
Sure. Brandy, I will email you some of our resources and contact information. I'm not, like I said, I'm still kind of new.
Oh, I'm sure. Yeah, I understand.
I'm still learning, but I will definitely hold on to your email address. That way I can send you what I do know is out there, and I'll put my email in the chat as well. Okay. That way, if anybody has any questions, like in particular, I would be more than happy to answer. So
congratulations on your role. You'll settle in just fine, I'm sure.
Thank you.
Thank you, Casey. And Shannondale, I'm so sorry that I missed you with Salvation Army of Bristol, but Shannon has posted some information in the chat as far as Soup Kitchen has started picking up a bit, and the shelter is starting to get more clients due to the cold temperatures. It got really cold the other night. I don't know if it was a white flag night or not, and that they're gearing up for Christmas and in desperate need of kettle worker volunteers. And then Angel Tree signups are still continuing until October 31st. So that's all in the chat. Shannon, I'm so sorry that I missed you. All right, anybody else have any updates? Casey put her email in the chat. Brittany has the Strong ACC all member meeting information in the chat. All right. Well, if there are no other questions, no other updates. Okay, we'll get this recording out soon. So if you need to go back and look at what somebody said or what the details were, we'll also be sending out the chat. So do take a minute to put your contact information in the chat or any updates that you might want to add to that, because we will always send the chat box information out as well. And if there are no other questions, our next meeting is in 2 weeks. So it is scheduled for November the 5th at 11 a.m. Again, the survey, we'll be sending that survey link out when we send the recording. So do take just a few minutes to fill out the survey if you haven't done so already, to let us know what you'd like to see going forward with this meeting, how that works, those types of things. All right, everybody. Thank you all for your time. Have a fantastic weekend. Have a fantastic rest of your Friday. We'll see you in a couple weeks.